What's up, everyone? Welcome back to ShockDoc Medical. I'm Dr. Raad, and today we're diving into a topic that's super relevant and, honestly, a bit of a mystery for many of us: hair loss. Have you ever wondered why some folks seem to lose their hair all of a sudden, while others experience gradual thinning? And what if I told you that a detailed history could unlock all the clues behind it? Stick around, because we're going to break down everything you need to know about taking a thorough history in patients with hair loss. And trust me, it might just change how you look at those strands falling out every day. All right, so let's set the stage. Hair loss isn't just about vanity. It can be a huge source of distress, and sometimes reversing it can be really challenging, if not impossible. For instance, androgenetic alopecia, the so-called male pattern baldness, tends to hit the vertex and temples hard in men, whereas women usually describe it as diffuse thinning across the scalp. But here's the kicker. The most common cause of sudden diffuse shedding is something called telogen effluvium. And the good news? With telogen effluvium, you can reassure your patient that while it might look alarming, it won't mean losing all their hair, and it should grow back. Breaking down the history. Now, when we're taking a history from a patient complaining about hair loss, there are some key questions we need to ask, almost like detective work. Let's run through them. Timing. When did you first notice the hair loss? Has this happened before? We need to figure out if the shedding was sudden or gradual. Pattern. Is the loss diffuse, or is it in patches? This helps distinguish conditions like telogen effluvium from something like alopecia areata, which can even present as alopecia totalis, all scalp hair, or universalis, all body hair. Extent. Is the hair loss complete, leaving bald patches, or just partial thinning? Location. Are you noticing hair loss elsewhere? Eyebrows, eyelashes, even in the armpits? Associated symptoms. Any itching, scaling, or signs of inflammation? Because while conditions like eczema or psoriasis aren't typically linked to hair loss, fungal infections can be. Hair care habits. How do you care for your hair? Do you use hot combs, perms, straighteners, or dyes? Do you tie your hair back tightly for long periods? Behavioral factors. Do you ever pull or pluck your hair? Sometimes stress or anxiety can lead to behaviors like trichotillomania. Medical history. Have you started any new medications recently? This is crucial because many drugs can trigger reversible hair loss. Environmental and family history. Any exposure to radiation? Is there a family history of hair loss, or do close contacts have similar issues? Triggering events. Was there any significant event 8 to 12 weeks before the hair loss started? This could be a serious illness, major surgery, or even postpartum changes. Since, during pregnancy, the hair grows longer and the shedding happens after childbirth. Other health issues. Do you have any other medical problem like iron deficiency or thyroid disorders? These conditions can also be behind diffuse hair loss. It might seem like a laundry list, but each question is a piece of the puzzle that helps us understand whether we're dealing with something like androgenetic alopecia, telogen effluvium, or even alopecia areata. Let's get into a bit of science. Our hair grows at about 0.3 to 0.4 millimeters a day, and not all hairs are in the same phase at the same time. Out of roughly 100,000 hairs on your scalp, about 90% are in the growth phase, known as anagen. Then you've got the catagen phase, which is like a transition. And finally, the telogen phase, where the hair rests before being shed. It's completely normal to lose 100 to 150 hairs a day. But in telogen effluvium, something like a major illness or surgery triggers a larger number of hairs to shift into the resting phase. And then boom, you see a lot more shedding 2 to 3 months later. Now, an important piece of the puzzle: medications. Drugs can be a sneaky culprit behind reversible hair loss. If you're reviewing a patient's history, you need to think about the following agents: anticoagulants and anti-neoplastic agents, antiretroviral drugs, oral contraceptives and progestin-releasing implants, gonadotropin-releasing hormone agonists, anti-estrogens and aromatase inhibitors, esterified estrogens methyltestosterone replacement therapy, extracorporeal membrane oxygenation, immunosuppressive drugs and interferons, minoxidil. Now, I know minoxidil is often used to treat hair loss, typically as a 5% topical solution applied twice a day, but in some cases, it's been noted as a cause of shedding in certain contexts. Psychotropic drugs, including various antidepressants, anxiolytics, dopaminergic therapies, and mood stabilizers, retinol, vitamin A, and retinoids. It's crucial to cross-check if any new medications were started before the hair loss began. Sometimes, just tweaking the dosage or switching drugs under medical supervision can reverse the problem. I've seen patients come into my clinic absolutely distraught over their hair loss. And let me tell you, it's not just about appearances. It can affect self-esteem and overall well-being. By taking a comprehensive history, we can often pinpoint whether the problem is temporary, like telogen effluvium following a stressful event, or postpartum changes, or if it's something more chronic like androgenetic alopecia. And if it's drug-induced, we might be able to adjust the treatment to help the hair bounce back. This isn't just academic, it's real-life detective work that can turn a potentially permanent problem into a reversible one. It's about empowering patients with knowledge and sometimes a lot of reassurance that yes, it's normal to shed hair, and in many cases, it will grow back. Now, I'd love to hear your thoughts. Have any of you experienced sudden hair shedding after an illness or medication change? Drop your stories in the comments below. And for all my fellow healthcare providers out there, what are your go-to questions when assessing hair loss? I'm always looking for tips and tricks to improve my approach. Remember, folks, the key here is a thorough history. It's all about connecting the dots, from the onset and pattern of hair loss to lifestyle factors and medication use. Each detail can help differentiate between conditions that look similar but require very different approaches. So, to wrap up, today we unraveled the mystery of hair loss history taking. We covered everything from the types of hair loss, like androgenetic alopecia and telogen effluvium, to the importance of detailed questioning and the role of medications in reversible hair shedding. Whether it's checking if a patient is losing more than the usual 100 to 150 hairs a day, or looking into a recent stressful event, every piece of information counts. If you found today's deep dive helpful, smash that subscribe button, give us a like, and share your questions or experiences in the comments. And don't forget to join our growing community of curious minds right here at ShockDoc Medical. Next week, we're gearing up to explore another groundbreaking topic that could change the way you think about everyday medical challenges. This is Dr. Raad, signing off with a reminder to always dig deep, ask the right questions, and stay informed. Catch you next time. Stay curious, stay healthy.